looking at all that we've heard so far, you realize that using the bad nut analogy, there are a lot of people are doing good things, good stuff, but those who are doing not so much up to the standards make the entire thing look bad. And we wish that anybody reporting to any health facility in Ghana can expect a basic standard of care that is not based on who you meet or who you are. You should expect some standard, and that is the whole aim of this public lecture. As you listen to, if you know someone, or you are known, or you are important, then you are likely to get a good care. We don't want that. We wish, because we all ourselves can be patient at any time. So that aside, now to the specific question you asked. The teaching, and it has always been, in the case of an emergency, we have what we call resuscitation. Resuscitation can always go alongside initial details of the patient. Yes, the details are very important because they tell us what you can do and what you cannot do. So we need to know your name so that we don't even confuse your medication with another person. We need to know your age, so we give medication that is age appropriate. We need to know your gender, which will be obvious to us, and a few other things. These are important. Your vital signs will tell us what to even do and not to do. Some patients may see this as time wasting, but we have always taught students and clinicians that do not waste unnecessary time doing these things. And some obvious things can go hand in hand. So you've seen a patient who is unconscious. Start the process of resuscitation even before you want to ask this. The person cannot tell you their name. They cannot tell you bank details. They cannot tell their mode of financing. So what is obvious to you, it is expected that you will start that whilst you get the additional information. But definitely those informations are also important for this care and for subsequent care to prevent medical errors. So that is the first response. The second one of attending antenatal somewhere, and I think this is a very, very unfortunate situation. And the acts, will I say, are condemnable if they are what they have been narrated here. If you look at the situation, and I'm speaking with passion on this one because I'm an obstetrician, I take care of pregnant women. There is a good reason why, of all the medical records, it is the pregnancy records of a woman that is given to her to carry along everywhere. All of us, your health records are in the hospital, but for the pregnant woman, we give you a handheld book that has all your records. And the reason is that we know an emergency can occur anytime, and she'll be able to enter into any facility. The provider meeting you, just looking at that book, you have a fair idea what you've been through, what to expect, and what they should do for you. And that is the reason why we give that out. Now, this woman delivers at home at a time of a national emergency where we're in lockdown. This is a preterm delivery. Baby may need help, resuscitation, and all of that. And home delivery itself, the environment, whether there was any infection and prophylaxis to prevent that, all these were not looked at simply because she did not attend antenatal there. That is not acceptable in any way, whether public or private. And this is a government facility. And I think yesterday Dr. Morrison made a point. No facility has the right to turn anybody away in an emergency. In a walk-in, a private facility can decide, okay, we do not wish to have you as our patient. But a public facility, by virtue of the fact that you are funded by the government of Ghana, you are mandated by law to care for every Ghanaian who walks into that facility. And you cannot turn people away. And this case is an emergency. So whether it was private or public, once she walked in there, she needed to be attended to. And to think of the fact that we are in lockdown and we're worried that our patients are not coming to hospital, and someone has actually walked to the hospital and gets this treatment, I don't think there's any justification for that kind of treatment.